Alberta confirming the country's second blood clot in a patient who received the Oxford AstraZeneca vaccine. The first case of its kind in Alberta, the province is choosing not to release more identifiable information about the patient, a man in his 60s who is recovering in hospital. Dr. Deena Hinshaw says his symptoms developed within the expected 4 to 20-day window after receiving the vaccine, but emphasizes the risks of not getting the shot remain much higher than the risk of getting a blood clot.
This is 2 cases out of more than 700,000 doses in Canada. Somebody who gets COVID-19 in this age group has an extremely high risk of having blood clots from that infection, of needing hospital care. And as I mentioned earlier, of every 200 people in this age group who get COVID-19, one of them, unfortunately, has passed away in the last year.
The case comes as 2 walk-in AstraZeneca clinics open to immunize those between 55 and 64, and mass vaccination sites already taking patients in Calgary and Edmonton see a drop in appointments. Dr. Hinshaw says that the province is discussing expanding the eligibility for the AstraZeneca shot and that the rare discovery of a vaccine-induced blood clot does not change her previous risk assessment. She adds that they do not currently anticipate a delay in the rollout of the AstraZeneca vaccine, with the next shipment to Alberta expected for late this month at the earliest.